If Mount Sinai and Anthem Blue Cross Blue Shield don't reach an agreement this month, thousands of patients will be forced to either pay a hefty price for care or find new doctors elsewhere.
Health reporter Jenna DeAngelis spoke with both parties involved and an impacted family.
DeAngelis struggled for 7 months with severe involuntary tics, punching himself and yelling before anyone knew why this was happening. The journey to find answers began at 13 years old when Callum started experiencing trouble breathing. His parents recorded these videos to document the severity, and more than 30 doctors later, he finally got a proper diagnosis: Tourette syndrome.
Our heroes are at Mount Sinai.
In 2022, Callum underwent a life-altering procedure, most commonly used for Parkinson's, known as deep brain stimulation surgery. It uses a pacemaker-like device to send electrical signals to areas of the brain that control movement.
It has made a difference in his life. Like, I don't know how we would have gotten him to 20 years old.
He's told me a few times he totally saved his life.
It totally saved his life.
So
not even a question. But it's not a cure.
Callum continues to see several doctors at Mount Sinai. His father is also a patient after a tumor was discovered on his pituitary gland.
I just had the surgery back in October to have removed. And I'm one of the lucky few who it's back.
How many doctors between you and your son are you seeing here at Mount Sinai?
It would be 10 total from between the two of them.
10 doctors between you and your son, and now they are all out of network?
Yes.
Mount Sinai and Anthem Blue Cross Blue Shield failed to reach a contract agreement by December 31st, which means about 9,000 Mount Sinai physicians are no longer considered in network. State law requires the hospital to remain in network until March 1st.
We have about 200,000 unique Anthem patients that seek care from a provider at Mount Sinai on an annual basis.
Brent Estes with Mount Sinai Health System says the renegotiation process began last spring and hit a roadblock around Thanksgiving.
And unfortunately, after that weekend, Anthem decided to withdraw all of its offers and proposals off the table. And we've had very little contact with them since that point in time.
This means many will be forced to find doctors elsewhere. Neurosurgeon Dr. Ted Panoff says Callum's case is a complex one, so it will be challenging to find another team to take it on.
The idea that now I have to tell patients we can no longer care for them because this is happening, that's incredibly frustrating.
In a statement, an Anthem spokesperson said in part, Anthem's priority is ensuring that Mount Sinai patients receive uninterrupted care and understand their options. For members who are in active or ongoing treatment, continuity of care protections are designed to help prevent disruption during a network transition.
The insurance company and the hospital sent out letters, and one of the things says is that if you are a complex case, you can get a continuity of care, but the hoops that they're putting us through are designed to make us fail.
The DeAngelis say, adding to confusion, they're covered by Highmark, a separate Blue Cross Blue Shield plan based out of their home state, Pennsylvania, not Anthem, so it's been difficult to get answers. But after we reached out, Anthem connected with the Highmark team, who said in-network care will continue for now for the DeAngelis. The family argues they've heard that before.
There's people that I think are giving up. And then what does that mean for the care for themselves or their loved one?
As the clock is ticking to reach an agreement by the March 1st deadline. Jenna DeAngelis, CBS News, New York.